Hi there, my name's Karen from the Wellbeing Services South Glasgow, and I'm here to talk to you about agoraphobia. The term agoraphobia originates from the Greek word agora, meaning open space or marketplace, and from the English word phobia, meaning fear. Often when we hear the term agoraphobia, we tend to view it as a fear of open spaces. However, it is actually much more complex. Agoraphobia can be defined as a fear of being in a situation where escape may be difficult or that help may not be available if things go wrong. Examples of this can be leaving the house, being alone, being in crowded places, being in an elevator, or being in public transport. Agoraphobia is a type of anxiety disorder and is characterised by the individual holding the belief that certain situations are out of their control, which in turn induces feelings of fear and panic. When faced with these types of situations, they are typically accompanied by panic attacks. However, please note that in some cases, the agoraphobic sufferer may not experience panic attacks. Panic attacks can often increase the fear of going outside, as they are fearful of losing control, having another panic attack in public, and it being noted by others. As a result, to help manage these feelings, the individual usually adopts safety or avoidance behaviours. Examples of safety behaviours are only leaving the house when accompanied by somebody they trust or using substances or alcohol. Example of avoidance behaviours are avoiding specific situations altogether, such as lifts, avoiding crowded places, and in severe cases the agoraphobic sufferer may become housebound. As you can imagine, agoraphobia is detrimental to the overall well-being of the individual, as it prevents them from doing the things that they love. It can prevent them from seeking medical support and can lead to the development of other mental health difficulties such as depression. Symptoms of agoraphobia. When faced with situations which are perceived as frightening or overwhelming, the individual will experience a range of symptoms. These can be placed in the following categories: physical sensations, unhelpful thoughts, feelings, and behaviours. Physical sensations. Physical symptoms are changes that occur in the individual's body in relation to the activation of the fight, flight, or freeze system. This is our inbuilt alarm system warning us of danger. Whether this is a real or perceived threat, the physiological response will remain the same. Physical symptoms will include rapid heartbeat, rapid breathing, increased sweating, nausea, shaking, dizziness, and chest pain. Remember, if you experience these types of symptoms, it is your body trying to protect you from harm. Unhelpful thoughts. This is when the individual overestimates the potential danger they are likely to face, as well as underestimating their ability to deal with the situation. Examples of unhelpful thoughts are something awful will happen, or I won't be able to get out and I will be trapped, I can't cope without the support of others, or substances will give me the courage to go out. The individual may also believe that they will be perceived negatively by others. For example, if I go out, I will have a panic attack and people will laugh, or people will look at me and think that I am weird. Feelings. Feelings are like messages. They tell us how we feel about situations. Individuals who suffer from agoraphobia are likely to experience emotions such as fear, anxiety, distraught, frustration, and possibly even anger. Behaviours. These are the actions which people will adopt in order to keep themselves safe. As stated above, these generally take the form of avoiding situations which they believe could lead to another panic attack. It can also include getting others to do things for them, using online services in order to stay in the house, or relying on medication to leave the house. Due to the effectiveness of avoidance in reducing the symptoms of anxiety, people unfortunately do not have the opportunity to learn that the fearful situations are manageable and that they can overcome their fear. Your thoughts, feelings, physical sensations and behaviours are all interconnected, and it is these symptoms which can keep you in a vicious cycle of agoraphobia. Let's take a look at an example. When he was a young boy, James was trapped in an elevator. This caused him to experience intense feelings of fear, and as a result, he experienced his first panic attack. James now avoids going into elevators as he has developed the belief that once again he will become trapped and have a panic attack. Let's break this down further. So the situation that caused the panic attack was going into an elevator. This led to James developing unhelpful thoughts such as I will get trapped and have a panic attack, or that people will notice and laugh at me. This led to feelings of fear, anxiety, dread, worry, frustration, and anger. and the physical sensations he was experiencing were shaking, sweating, racing heart, rapid breathing and nausea. This led to him using the behaviour of avoidance, where he would not go into the lift and took the stairs instead. This avoidance reduces the feelings of anxiety, and James learns that this is the best strategy for dealing with anxiety-provoking situations, and so the cycle continues. What causes agoraphobia? Agoraphobia tends to develop from panic disorder and occurs when individuals associate panic attacks with certain places, people and situations where they originally occurred. As a result, they develop a fear that a panic attack will reoccur in the same or similar situations and will therefore avoid that situation. Whilst the exact cause of agoraphobia is unknown, there are several other factors which could increase the likelihood of the condition developing. For example, it could be learned experiences where the behaviours have been observed and learned from significant others. Genetics. It may be that there is a family history of agoraphobia, or that your temperament places you at higher risk of developing it. Traumatic incidents such as bereavement can also trigger agoraphobia. Lifestyle environmental stress can also increase the risk of developing agoraphobia. Treatment. Recommended treatment for agoraphobia is self-help. It is helpful for you to learn techniques such as relaxation and breathing exercises which will help you manage the situations. Lifestyle changes. For example, trying to reduce any environmental stressors. Relaxation techniques may also help with this. Regular exercise can help relieve stress and tension. Avoid alcohol and substance use. As well as this may help in the short term, they make symptoms worse in the long run. Avoid caffeine, as these have a stimulant effect and can make symptoms worse. Psychological treatment such as cognitive behavioural therapy can help teach you how to challenge the unhelpful thoughts and manage the distressing emotions and develop the appropriate coping strategies and behaviours. Medication. Certain medications can be used in the treatment of agoraphobia. This should be discussed with your GP. Most people find a combination of the above options to be helpful in the treatment of agoraphobia. If you feel that you would benefit from support with your agoraphobia, either contact your GP and discuss available options, or alternatively, we at The Wellbeing offer group CBT aimed at supporting individuals to effectively manage their agoraphobia. The Wellbeing Service website also has a variety of helpful free resources and information that can be easily accessed. Helpful ways to help you begin to cope and manage symptoms. Belly breathing. The way we breathe is strongly linked to the way we feel. When we are relaxed, we breathe slowly, and when we are anxious, we breathe more quickly. This allows the body to take in more oxygen and prepare for fight or flight response. It is therefore important to try and slow down our breathing, as this signals the body that it is safe. Breathing is far more effective when we use our diaphragms rather than our chest muscles. Sit comfortably in a chair and place a hand on your belly. Take 2 or 3 large breaths and imagine that there is a balloon in your belly. It should inflate when you breathe in. Practice so that it is the lower hand on your abdomen that moves as you breathe in and out. People often think that their tummy goes in when they breathe in, but the reverse should be the case. As you breathe in, your belly should move out. When you're feeling tense or trying to relax, try breathing out a little bit more slowly and more deeply, noticing a short pause before the in-breath takes over. Don't exaggerate the in-breath, just let it happen. You might find it useful to count slowly or prolong a word such as one or peace to help elongate the out-breath a little. You can either say this to yourself or out loud. Mindfulness. This is a technique where we learn to pay attention in a specific way, on purpose, in the present moment, and without judgment. Mindfulness is a practical way to notice your thoughts, physical sensations, sights, sounds, and smells. We can often do daily tasks be miles away without realising it. In this state, we are more likely to have our buttons pressed, as our environment may trigger old unhelpful thinking patterns. By becoming more aware of our thoughts, feelings, and bodily sensations, we give ourselves more opportunity to challenge and change our old thinking habits that may cause us problems. I'll talk you through a mindfulness activity. Choose an activity to do mindfully throughout the day for 1 or 2 minutes. For example, drinking a cup of tea, going for a walk, or washing the dishes. Whatever you're doing, be in that moment right now. Describe what you see, hear, smell, touch, feel, and breathe. Other thoughts will come into your mind. Simply notice when they and sensations occur and then refocus on your chosen mindfulness activity. Be patient and compassionate with yourself. Describe rather than judge, good or bad, pleasant or unpleasant. Visualization, safe place imagery. If it is safe to do so, try to think of a place or situation that makes you feel peaceful, relaxed or at ease. Once you have this image in your mind, try to focus your attention on it. Imagine a place where you feel calm, peaceful and safe. It may be a place you've been to before, somewhere you've dreamt about going to, or maybe somewhere you've seen a picture of. Focus on the colours in your peaceful, safe place. Now notice the sounds that are around you, or perhaps the silence. Think about any smells you notice there. Then focus on any skin sensations, the earth beneath you, the temperature, any movement of air, anything else you can touch. Now whilst you're in your peaceful and safe place, you might choose to give it a name, whether it's one word or a phrase that you can use to bring that image back anytime you need to. You can choose to linger there a while, just enjoying the peacefulness and serenity, or you can leave whenever you want to, just by opening your eyes and being aware of where you are now. Remember, if relaxation is new to you, then these techniques may feel a bit strange at first. It is important to practice these techniques regularly and at the time when you are feeling less stress, as this can help you apply the techniques more easily when feeling stressed or anxious. Remember, practice makes perfect. Challenge your thoughts. When we are anxious or stressed, we tend to view things through a negative filter, which makes our thoughts unhelpful. We also presume that because we have thought something, then it must be factual and accurate. This is not true. Just because you think something does not mean that it is true. When faced with anxiety-provoking situations, it can be helpful to ask yourself the following questions. Is what I am thinking fact or an opinion? Am I viewing the situation unrealistically? Do I have my negative filter on? How likely is it that what I believe is going to happen will actually happen? Is there another way for me to view the situation? Or what would I say to a friend if they were in a similar situation? Remind yourself that the physical symptoms you're experiencing are your body's natural response to the fight or flight response and are simply trying to protect you and keep you safe. These will eventually pass. You might find it helpful to develop some coping statements that you can say to yourself to help cope with stressful situations, e.g., I can do this, or these physical symptoms are here to protect me and will pass. Stay where you are. Try not to resist the urge to run to a place of safety, as this will only reinforce the vicious cycle. Instead, try to stay in the situation until the anxiety reduces or passes. Use the thought-challenging, breathing relaxation techniques to help you manage the situation. Maybe focus on something that is visible and non-threatening, such as items on a supermarket shelf. If you would like more information, please see the Wellbeing website. If you are really struggling, please contact your GP, NHS 24 or the crisis team. This can be done through NHS 24 on 111. Alternatively, telephone the Samaritans on 116 123 or try to talk through things with a loved one. I hope that you have found this helpful. Thank you. Bye.